Hey everybody, it's Ed O'Keefe, and welcome to another episode of America's Leading Dentist. I'm here with Dr. Amanda Cobb of Cosmetic and Restorative Dentistry of the Keys in Big Pine, Florida, right?
Big Pine Key.
Big Pine Key, and as well as Dream Sleep Center, which is a sleep practice dedicated to helping people with sleep apnea.
Yep.
Correct. Okay, cool. And you have locations in Big Pine Key and Key West, correct?
Yes, so the dental office is just in Big Pine Key, but we see our sleep patients in Big Pine and in Key West.
Sounds like amazing places I want to be. Okay.
It is beautiful down there.
Yeah, I know. You talk to a Chicagoan, they're always like, oh my gosh, can we just go there? It's amazing. Awesome. Well, great to have you on the show. So today we're going to be covering a few different topics. So let me just give you an overview of it. So we're going to cover sleep apnea, the miracle of dental implants, and then we're also even going to cover the power of Invisalign and cosmetic dentistry, correct?
Yes.
Yeah, I know. Super cool. So I want to start with sleep apnea because I think that is one of the most little known, most life-threatening areas that patients don't realize, because I didn't realize that they could actually visit a dental office, but not any old dental office. It's dentists who are trained in treating sleep apnea, which is yours does. Here's what I wanted to frame it with. I didn't realize that 20 to 50 million people in North America right now are walking around with undiagnosed sleep apnea. When people think of snoring, they think of sleep apnea, and then they think of treatment is CPAP machines. And that 74% of people who are diagnosed with CPAP machines are non-compliant, which means they don't use them, which then leads to life-threatening issues for all these people. So that's a lot of people.
It is.
Around us.
Yes.
And when I started looking into this, and I'm going to stop talking, Dr. Cobb, I started realizing that I had so many loved ones in my inner circle that have all the symptoms that we're going to talk about for sleep apnea.
Yes. Yeah, I first got interested in sleep apnea because I had taken a course at a meeting, and I realized that both of my parents are horrible snorers, and so I started venturing into it and got them tested and treated. And, then life got busy. I didn't really bring it into my dental practice years ago when I first started.
Yeah.
But now I have taken a lot of advanced training and got in with some companies that help me do the medical billing side of it so I can find and treat those patients because it is a huge problem. And I see them all the time in my regular dental office, and I bring that problem to their attention, and
Yeah.
they had no idea that something was going on. And these are patients that see their doctor regularly, but their doctors are so busy that if they don't bring it up to the doctor, then the doctor doesn't even realize that they have it.
Yeah, which is pretty amazing because actually I was surprised that that a dental practice actually helps assess and identify and then intervene with sleep apnea. But then it actually makes total sense because you're in the mouth all
Yeah.
day long.
Yeah, and we see a lot of signs and symptoms of it when we're just doing a normal exam on a patient. And then, we follow that up with questions and ask them about their sleep habits and some of their medical conditions that are related. And if I feel that someone's at risk, I'll get them to a sleep physician for testing because I don't do any of the diagnosis
Yeah.
on that. It's a medical condition, but I can absolutely recognize the signs and symptoms and get them tested and then ideally treated.
Awesome. Well, you mentioned signs and symptoms. So I mentioned a couple things like snoring, which is pretty typical. Everyone knows that. But there's also misconceptions about that. So can you share some of the other signs and symptoms that most people might not really know about?
Yeah, so snoring is a big one. About 80% of snorers actually have some form of sleep apnea. We see patients, when I'm looking in someone's mouth, I'll see a patient with worn down teeth, someone that has a small jaw or a lower jaw that's set back farther, somebody that has an enlarged tongue or a narrow airway. We can see their tonsils and see that that's narrowed. So I do see a lot of signs in there. I mean, I'll be working on somebody's teeth on the upper all the way in the back, and their tongue is all over me the whole time. And,
Was that right? Yeah.
and then I'm pretty sure they have sleep apnea when I see that going on.
And
So.
can you explain that a little bit? Just like what actually is going on that means sleep apnea?
Yeah, so sleep apnea is when somebody has episodes at night where they stop breathing or their breathing gets so low that their oxygen starts to drop. So they're not getting enough air when they're sleeping. And that is most often caused by the tongue falling back in the airway and blocking it. So that's why it definitely has a correlation to dentistry, because we deal with the tongue
Yeah.
all the time, and we're the ones that are looking at the tongue regularly. And the appliances that we use to treat sleep apnea help to pull the lower jaw forward, and that brings the tongue with it and keeps it from falling back and blocking the airway.
So by using a simple oral appliance, you can bring the jaw a little bit forward, and then it stops the number one issue, which is the tongue blocking the airway.
Yep.
Wow. Okay, so what I didn't realize was that when people stop breathing, and can you give everybody an idea of like how many times like people with mild to severe sleep apnea actually stop breathing at night? Because this blew me away.
Yeah, so somebody with mild would be under 15 times an hour, and then moderate would be 15 to 29.
That means they're stopping their ability to breathe 15 to 20. Think about that.
For at least 10 seconds.
For at least 10 seconds.
Yeah.
15 to 29 times an hour. That's insane.
Yes.
Okay, and then severe would be
30 and above. Yeah.
That's crazy.
Yeah, and I've seen patients that stop breathing, 70 to 90 times an hour, which is a huge amount. And those patients oftentimes will try a CPAP. For severe patients, we recommend CPAPs, but if they can't tolerate it or they're just not wearing it, then what we offer is a great alternative even for severe patients.
So what I wanted to highlight here is that do you mind sharing? You probably have a couple what I kind of want to talk about crisis in the body when you stop. Like I didn't realize that the danger that you had, because I was like, well, why do people die who end up having sleep apnea? Like I didn't understand it. And that when correct me if I'm wrong or add on to this when I'm done, it's like, so what happens is I stop breathing, my body goes into kind of a fight or flight to wake me up. Mm-hmm. And then it starts pushing out cortisol, adrenaline, all these hormones that start getting the engine rolling. Like my heart's got to beat faster and harder, which equals high blood pressure. Mm-hmm. My teeth start grinding to wake me up. And then over time, you have higher risk of stroke, dementia, and these other elements because of the chronic crisis going on in the body due to sleep apnea. What have I left out?
Yeah, it all starts with oxygen. So once the oxygen drops below 90, the body starts having these alarm bells go off. And, the further it drops, the harder the body works to try to get that oxygen out to the brain, especially, and to the rest of the body. So the heart starts pumping faster, trying to move that blood around faster. And in the time that the body's supposed to be resting and the heart's supposed to be, barely working, it's working overtime and it's working almost harder than it does during the day. So, imagine if you're, running 30 miles every single day, you would probably wear out pretty quickly. And the same thing happens with the heart. So the dementia comes more from the lack of oxygen to the brain. All the tissues in the body, if they're not getting enough oxygen, they're not going to be up to their full potential. And, you're not going to be living a full life. And definitely it can cause premature death.
Now, I heard that if you pee a lot during the evening, that's another indication that you may have sleep apnea. Where I always thought as a guy, that just means you have prostate issues going on. So is that, and so I had asked that question, so is that just because you're being woken up and then your bladders, or what's going on there?
So in that process, it's that you're in a lighter sleep, so you're going to be more prone to waking up. So when you have sleep apnea, it's hard to get into a deep sleep, so you're not getting that restful sleep. But there's another process going on where you end up with a lot of pressure in your abdomen, and then that releases a peptide that works on your kidneys, and then they start making
To
more
wake you
urine.
up.
So you actually end up, just making more urine from the excess pressure. So when the airway gets blocked, you get this pressure in your chest,
Yeah.
and then that acts to release a peptide, and the body's trying to remove fluids to decrease
Yeah.
that pressure.
Okay, I know our audience does not need to know what the peptide is. What's the peptide? Do you know?
It's natriuretic peptide.
Okay. Yeah. Okay.
ANP.
Natriuretic, like a diuretic. Yeah. 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 Oh, very cool. Okay. Wow. Okay. So then, if any of these symptoms they can relate to, before I do that, I was going to say before they can come in your office. Do you have a story of somebody that you treated and then like kind of like their before and after story?
Yeah, so I had a patient that I treated kind of early on when I was starting to treat sleep apnea, and she was a mild case, but she was snoring, and she was a very petite woman, so
Yeah.
not the typical,
Not the typical. Yeah.
patient that you would think would have sleep
Yeah.
apnea. So, but she had a smaller jaw and, had some of the signs and symptoms, so we got her tested. Her oxygen was dropping, I think down around 80% at night. So she wasn't having a lot of events, but her events were bad enough that her oxygen was dropping. She was also snoring to the point where it was disturbing her husband. So we got her into an oral appliance, and all of our oral appliances are completely custom made. We use a digital scanner, so we don't even have to take impressions. And we get the scans of the teeth. We send them off to the lab, and it's so precise that they almost always just snap right in without any adjustments.
That's amazing.
And what it is, it's an upper and lower mouth guard, and then they have a connection between them that helps keep that jaw forward. Yeah. And, with hers, just in her very first set where we didn't have it adjusted very far forward, she already felt tremendous relief, and she was sleeping better, and she wasn't disturbing her husband. We did do a little bit of testing to check on her, and we advanced her a little further, but she's doing great and is super happy.
That's amazing. The question I want to ask you too is like when people think of sleep test, they think of sleep lab, wires all over their face, and a scary guy looking through the glass. That's old. That does not happen anymore. How do people get sleep tests now?
So there are still sleep labs, but the vast majority of patients can do testing at home. Okay. So what we do is we use a company called sleeptest.com, and we set up them for the referral, and then they do a telemed visit with a sleep doctor. So these are board certified sleep physicians. These guys really know their stuff. And then they ship our patients a device to wear for 2 nights usually. They wear it, they ship it back, and then we get everything we need to get the patient treated, and we get all the reports and the data back from them on our online portal.
Yeah, I love it. And then you can do all the rest of the work in the office. It's amazing.
Yeah, and we even, for patients who are just kind of questioning whether they might have something going on, I actually have a few devices in my office. It's a little sleep testing ring that they can wear, and I send those home with patients complimentary and let them wear it for a night, and then I get a full report back on what happened while they were sleeping. And I can't get a diagnosis off of that myself, but I can show them, look, this is what's going on.
This is what I can see right here.
Want to get you a full test.
That's so amazing. Yeah. That's great. That's great.
And some people are kind of on the fence, not sure if they have it, and. They're always concerned about the cost of the sleep testing, but
let's talk about it.
This company will bill medical insurance, and they'll keep the costs very low. Even if someone was completely uninsured, I think at most they would spend $500 for the consults and the testing. So it's well worth it to make sure that your, health is okay and that you're gonna live a long, healthy life.
Yeah. So let's talk about I mean it's kind of a non-negotiable, honestly, when you start looking at it. So I love that you're sending patients home with is it a ring, you said?
Yeah, it's called a sleep image ring, and we actually just recently purchased some other ones called the Balin ring, because some of our patients were having trouble with the other ones connecting to a phone. And so
Okay.
we got ones that are a little easier to use.
So it's like a soft check. You can figure it, yeah. And then let's talk about like then. Okay, so I go get my consult. I definitely have mild to whatever might be a treatment in your office. Then what will be the protocol from there? And then what are my options from a pricing cost perspective?
So, if a patient is a good candidate for the oral appliance, then we get them back in, we review their sleep study results and kind of let them know what's going on and what their options are for treatment. And then for the oral appliance, we do work with medical insurance and we work with Medicare. So we're able to get these patients into a device for a pretty reasonable cost. Now, it varies tremendously with medical insurance based on what their benefits are. But we have options where, we can sometimes bill out of network, sometimes bill in network, and we give everybody a complimentary benefit check so that we can see what their benefits are and give them an estimate of their out of pocket.
That's right.
At the very most, if someone's benefits are not good and we need to just do a cash fee, we charge $3,500, and we offer financing options so that the patients are able to, make some lower monthly payments even out over a couple of years if they need to.
Yeah, so 3,500 divided by a couple of years, worst case scenario.
Yeah, I mean,
Comes
they
out
could
to,
spend
I
as
mean-
low as maybe $150, $200
Yeah.
a month even.
That's right.
Yeah.
I just got my 13-year-old braces. And I saw that, like, I was like, oh, braces. Again, it's my fifth child through your office. Are there any fifth child discounts? No, sir.
Yeah.
We actually add 10% on you. When they find out we go to Catholic schools, they add 30%. It's a joke for any of you Catholics out there, you'll get it. Okay. Sorry, I can go sideways in some of these jokes. That's pretty amazing. So is there, on the sleep side, is there anything you would want people to know in order to come in? Like, do you do a free consultation or?
Yes.
You do? Okay.
Yeah, we do free consultation, and we try to make it as seamless as we can to get patients tested and treated. And we also, if we feel they would be a better fit for a CPAP or another treatment, we can help them set that up, and we communicate with their medical doctor's offices and let them know what's going on and try to make sure we're getting everybody involved.
That's right. This is not like one of those treatments where it's just aesthetically cosmetic or like Botox or something where we want your business and no one else can have it type thing. Like, this is life-threatening. So I know Dr. Cobb we want to make you healthier and safer and in a better spot. So on this video somewhere, you'll see a link to, Dream Sleep Center, sleep practice, and please fill out the form there or give Dr. Cobb's office a call, get your free consultation while you're thinking of it, whether it's for you or a loved one, and just find out the facts. It's no obligation, no pressure. It's free.
Yeah.
It'd be amazing. Okay, let's segue a little bit. I want to talk about dental implants. Okay. So I remember when my parents were still living, I remember sitting there and I was learning about dentistry, and I was like, Mom and Dad, what do you not like about your dentures? And they went on for like 30 minutes. Oh, we can't eat the foods we love. Yeah. My teeth are always moving on me. They're popping out. They don't fit well. Don't like the denture cream. And I know things have probably changed a little bit, but not a lot in the denture world. Do you mind sharing why, like, if someone's missing teeth, they have failing teeth, why dental implants might be like the best option for them? And even we'll get to why it's even most cost effective in the big picture. So get after it there, Dr. Cobb.
So with dental implants, they are our number one choice for replacing missing teeth because they're the most like the natural teeth and they give patients the most function.
Awesome.
If somebody's wearing a denture, like you said, it's moving around, we have to do adjustments every so often to relieve sore spots. They can't bite into things the way they used to. They kind of have to relearn how to eat with a denture. With dental implants, most of the time when they go in, the patients are very functional once we get them restored, and they can eat whatever they want. They can be confident in their smile and not be worried that something's going to pop out when they're, out and talking to people they just met.
Sure.
The other big thing with dental implants is they help to preserve the bone.
This is a big one
Yes.
because it affects everything else.
Yes, so dental implants, you have to have enough bone to put them into. Now, even on patients that have lost some bone, we can often graft bone into their jaw and grow some of it back.
Yep.
But it's a tricky tissue. So bone, once it's lost, it's much harder to put it back. So I always tell patients, if you're gonna take a tooth out, you want to try to replace it within the first year when you still have a lot of bone.
Yeah.
And if they don't, it gets a lot less predictable about what options we have to replace it. So with a dental implant, it stimulates the bone like the natural tooth did, and that keeps the bone there. And when the bone's not being stimulated, it starts to resorb away. And in patients that have been missing teeth for a long time, especially denture wearers, they'll have very thin, resorbed bone, and they tend to need their dentures relined, make sometimes new dentures, and they'll even get to a point where, no matter what we do, the dentures just don't want to stay in because they don't even have a jaw ridge to kind of stick them to, if you will.
Yeah.
Now, it's always best to try to get those implants early on and, get those teeth replaced so that you keep that bone for life.
Well, I want to talk about the different options people have with implants because I think one of the misconceptions out there, there's a lot of big implant centers nowadays that are spending a lot of money and it's like they give people like one option or nothing, or they promise teeth in a day. And I know that's not always the option. Do you mind walking through, before we talk about investment and like the cost of implants and what options people have, do you mind sharing a little bit about what are the different types of implants that are available to fix different problems?
Yeah, so we have a kind of the simplest option is just a single implant. So if you lose a tooth, then we can put an implant in that place, and then we put a crown on it, and it's much like the natural tooth. Yeah. You can brush and floss it like you would the natural tooth, and you can eat just about anything with it. Wow. Then if patients are missing multiple teeth, we can sometimes do a bridge that's just attached to a couple of implants. So that's maybe 2 implants with some teeth connected over it.
Yeah.
And then if they're missing a lot of teeth, sometimes we will do even a denture or a partial denture that snaps onto the implant. So
onto an implant, yeah. So the bone is still getting stimulated, yeah.
Yeah, so you're keeping bone around those areas. And sometimes we'll do a case where we'll have teeth and then we'll have a couple implants and then we'll have something replacing the missing ones that snaps onto there. And then kind of your most replacement option would be a hybrid. So those are the things you see the ads for all the time, the all on 4, the all on X. And what that is when you're missing all of the teeth in an arch, we put in minimum of 4 implants in that jaw, sometimes 5 to 6, depending on how the case goes. And then we're able to put a temporary that attaches to those implants. They have to heal for at least 3 months, and then we put permanent on there. So it's kind of like a horseshoe shaped, full bridge that goes on those implants, and it's screwed in. You don't have to take it in and out, and you can eat with it very well.
That's amazing.
Yeah.
Can we talk about price range possibly?
Yeah, so a single implant, on a tooth that's already missing would probably be about $5,500 for all the components, the implant and the stuff that goes on it. And in my office, I do what's called a custom abutment. So there's ones you can buy from the company, and then there's ones you can get made custom from the lab. And I always make everything custom because I don't like the way the ones that you just buy fit. They're not made for your mouth. So that's why I may be a little bit more costly than some places, but when I put an implant in there, it does very well,
Can I ask a question on that? This is kind of a basic question that a non-dentist would ask, which is so are the ones that come from the company a little more cookie cutter, where the lab is just do you take a 3D scan of the area and send it to the lab, or how is that done? I'm just curious.
So when so I have a surgeon in my office who places my implants.
Oh, cool.
His name is Dr. Mazer. He's been doing implants for decades, and he is wonderful at them. and then I do all the restoration. So once it comes to me ready to go, then I take a special piece and put it on the implant, and I take a custom impression. And then from there, my lab builds everything from the gums up custom to that patient. So we're usually able to just screw the tooth right into the implant, so we don't have to use cement. Cement can be a cause of implant failure. So
Got it.
we make it custom. We have the piece
Body
coming up through the
rejected?
gums.
Is that why?
Sometimes, yeah. Sometimes an implant can fail if there's cement that's deep under the gums. And
Understood. Yeah.
if you buy a part that's not sitting at the right area in the gum line, and then you put a cemented crown over it, you can push that cement down deep under the gums and not be able to clean it, and then you can have an implant
I
fail.
feel like I'm learning so much right now. This is
So
so
we
great.
try to do all of our restorations, custom fitted for that patient, and make sure that they're going to be able to clean them properly so they can maintain them long term.
I love it. I love it. Okay, so then we talk about fee and expense. So one of the obvious questions is, okay, not cheap.
Yeah.
That's an investment. How do you help? Some people may have savings set aside or something that they set aside for this, but I know that's probably the minority. So then how do people, what should people know about the different options of payment and cost, and how do they work with the dental practice?
So, with implants, one of the nice things is that it is a multi-step treatment. So we only charge our patients for the step that we did at that time.
Okay.
And then the next step comes several months down the road. But it's still a big expense.
Yep.
So, if we're doing a full hybrid, that's usually going to cost around 30, maybe even above $30,000 if they need a lot of extractions and a
You're
lot
worth
of
it.
grafting.
Do you hear me? You're worth it.
It is.
You've
It's
been
very
wondering,
worth
like,
it.
what is it worth it to have my full teeth back again
Yeah.
and being able to smile and get my youth and my invigoration back again?
Yeah, that is a big factor too. With implants, they fill the face out so they can make patients look younger because
Yeah.
they're not having the sunken face because
right.
they're missing teeth in
That's
the
right.
back. But back to the finance.
Sorry, I get a little excited. I think, like, 30 grand might sound like a lot, but over 3 to 4 years with financing and stages.
Yeah, so we work with different financing companies, and my staff is great at going over that with the patients and getting them a full breakdown. So
Yeah.
everybody that comes into my office gets a full treatment plan printed out with
Yeah.
each step split up, how much they're going to owe at each point, and we really try to work with them to find something that they can afford.
Yeah.
And so that's why we have the options in between where we maybe do a couple of implants and then a snap-on denture. So sometimes patients can't afford the full hybrid, and then we do that option, and they do great with that too because at least the implants are anchoring the denture in, so
right.
they don't have to, have it popping out on them and moving.
Yeah, totally. Well, I think like, the phrase comes to mind is like you're paying for it already by not having it.
Yeah.
Right. A lot of times people will go buy a car that, spend 50, 60 grand or 80 grand on a car, and you can get your teeth, and they don't think the same way about the monthly installments.
Yeah.
Or they'll go on a fancy vacation that they use once and it's gone.
Yeah.
Versus this can transform my life. And
It can.
so when we go on the next vacation, I can enjoy it even more.
Yeah.
Do you offer free like what does it look like when people come in for implant consultation?
So we charge, we have a special for $125 for an implant consultation, and then we take the needed x-rays that they will need for that procedure.
Right
and,
there. Yeah.
Yep, and then we go over everything. And most of the time, I'm able to get them the full treatment plan when they come to see me. If there's a case that's a little questionable, then we'll have them do a separate visit with our surgeon before we schedule the surgery.
Yeah, great. All right, sounds awesome. So, hey, if you're watching this and you're like, hey, I've been putting off getting dental implants, I'm missing teeth, got my dentures, been wondering, maybe you've done some research, maybe you've even visited a center or two and you're like, this isn't for me. I have great news. You can visit Dr. Amanda Cobb and her team and either get a second opinion or find a new dental home. So make sure you take advantage of that. So they love to see you there. Okay. Want to segue to one more topic while I got you. So I know you do Invisalign, and I know you do cosmetic dentistry and full mouth rehab. So why don't you just walk through like why you like doing Invisalign, who it's for, and yeah, who should come in for.
Yeah, so the Invisalign is a great treatment. It's clear aligners that the patients wear over their teeth, and we put some little bumps on their teeth. We call them attachments that
Yeah.
help to move the teeth. And so they're able to wear these and not have that metal brace face,
Yeah.
you know. So a lot of adults like them because they can straighten their teeth without looking like they're back in middle school
Yeah.
again. But we also will treat teenagers and sometimes even younger kids can benefit from early Invisalign because their jaw might be needing to expand or
Yeah.
their teeth are, even before they get all the permanent teeth, their teeth can be so crooked that we want to intervene
Wow.
to help them later on. But most of my patients, I would say, are adults that are just wanting to enhance their smile, and a lot of our cases we can finish in under a year, sometimes even 6 months, you know. It doesn't have to be a full blown, 3-year case that drags on forever. We can address the issues that they are concerned with and get them done quickly. So we treat a full range on that.
Yeah. And then I am segueing into cosmetic dentistry.
Mhm.
So what do you see a lot in the office as far as what types of cosmetic dentistry?
So we do crowns, we do veneers, we do cosmetic bonding. So pretty much any issue that the patients are having with their smile that they want to correct, we can come up with a plan to fix it. So
What's an example of that? Like when they come into you, what are they saying? Like, I like this, or I don't like this about
they'll
the smile.
say like, oh, I've got this one tooth crooked, my smile's not bright enough. Sometimes patients will have like discolored teeth from when they
Yeah.
were young and they took certain medications that cause
That's
that.
a good point.
Sometimes they'll have decay on their teeth that's causing some teeth to look dark and brown. So, and we pretty much do it all. But with our cosmetic patients, especially if it's a bigger case, what's kind of a cool thing is we can take scans of their teeth. We can get 3D printed models and we get our lab to do a cosmetic workup. And so from there, we can take our material that we use to make our temporaries and do a mock-up where we actually can stick material right over their teeth to show them what their smile will look like when we're done.
That's amazing.
And they kind of get a preview before they commit, and we put them in.
What is that called something or no? Do you call it anything? Like,
I don't have a specific term for it.
we gotta make a name off. That's pretty cool.
We call it a mock-up. It's a cosmetic mock-up. So
I love it.
And that material just peels right back off so they can see what it'll look like.
Oh, really? Okay.
And then, we also, when we put our patients in temporaries, so once we start the work, then they can get a trial of what it's going to look like, and we can make any tweaks that they have. I have a great lab that will take all kinds of photos and we even sometimes send the lab old pictures of the patient, the way their smile used to look, so they can try to bring that youthful smile back for them.
Awesome.
And we do Zoom whitening too for the ones that just want to brighten it up.
Do you have a story of anyone who's come in for like a full mouth reconstruction or rehab, and like before and after, a little bit of or cosmetic dentistry you want to share?
Yeah, I mean, I had one patient who she was in her probably early 60s, and she had wanted white teeth her whole life. And this was a case where the patient had, I think, probably had some tetracycline when she was young, and that caused her teeth to be forever discolored. Yeah. So even though you can whiten them some, they're just never going to be that bright white. So we did veneers on her, and she was so happy. She started crying as soon as she saw the final result. Even in the temporary, she was thrilled. Wow. And so she comes in now. That's probably 3 or 4 years ago that we did that case. And every time she comes into the office, I'm just so happy with my teeth. Oh. They're awesome.
Yeah, you're transforming smiles, but changing lives.
Yeah. So we kind of gave her that thing she'd always dreamed of, and she finally was able to to achieve it.
Okay. Now
Yeah.
tell me about your in-house membership program.
Yeah, so we have a in-house plan. It's called Clear. And so what we do with that is we offer our patients a bundle where they can get their exams, their x-rays, their cleanings all included for the year, and then they get a discount on our services. So we have a lot of patients that don't have insurance, or if they do, their insurance only covers like maybe $1,000 for the year. So it's generally a better deal for them than some of these insurance plans, and then they're able to get as much work as they want. There's no limits on it. And they're able to, get what they need done and keep it affordable, and then they can keep up with their maintenance, because
Yeah.
I don't like it when my patients don't come back for their cleanings, but
Yeah.
if they're already included, they're happy to
They're
come
going to
in.
do them. Yeah, 100%. So cosmetic and restorative dentistry of the Keys am I saying this right? Big Pine Key.
Big Pine Key,
Big Pine Key, Florida. And then we have your sleep practice, which is Dream Sleep Center. Now, is that in Big Pine as well?
Yes, yeah. So we see sleep patients in my main dental office, and then also in our office in Key West.
Awesome.
Mhm.
So if you're watching, you're like, this is the dental place, the dental home I want to give a shot to, give Dr. Cobb's office a call. If around this video you see a link to click on, take a quick survey, and then we'll get you in for an appointment. That'd be amazing as well. Is there anything else you want to share with people before we wrap up our interview?
Not that I can think of.
Okay.
I think we covered it all.
Yeah, and you got a beautiful family
Thank you.
and just transforming smiles and changing lives. So that's it. Thanks for watching, everybody. Thanks, Dr. Cobb.
Thank you.
All right, have a great day.
You too.